I'm Laili Rahayuwati from Faculty of Nursing, Universitas Pajajaran, would like to share some information regarding the review article. And I hope all of you in the best of health during the corona. And let's begin with the review article that I already done with also Dr. Myra, because she gave the inspiration regarding the title on stigmatization. My title of the review is Stigmatization on COVID-19 and Policy Interest, a narrative review, especially in Indonesia. For introduction, I would like to share some indicators. The problem starts when the increasing number of infectious cases from COVID-19 in the worldwide, and some public feel anxiety and worry, especially in several regions, not only in the Asia, but also in all of the world. This article try to picture or try to describe how the situation on Indonesia, especially the stigmatization on COVID-19. This article also utilizes the existing data from various sources, from journal articles to online media. The data is derived from various social media platforms such as Facebook, WhatsApp, Line, WeChat, Twitter, and Skype. This article also structured academically to get a summary of information regarding the virus, its spreading, and how it occurs in other countries to get the correct approach in Indonesia. Especially for method, I would like to make several steps till the analysis. The first step is determine the purpose of analysis related to stigma COVID-19. The second one is formulate the concept of stigma. And the third is information in the media and online articles are arranged in one case by case, because we know the situation are not similar one by one. As I mentioned, the situation, Indonesia is the country that which have more than 1,000 more ethnic group and 11,000 areas or regions. Therefore, it should be different situation between one area and another area. And the case also happen different. And I would like to follow the method after get information from media online. We took several analyses and make the narrative description, especially in the result. Before we are going to see the deeper regarding the Indonesian situation, in the first analysis, the article tried to explain several experiences from different countries. As we remember, the start of COVID-19 is published from China. And after that, the one country in Europe, especially Italy, reported the increasing number of patients. And it can be noted also the high number of cases in Italy is among elderly. And we also remember the reported data from Italy, the highest mortality is come from the elderly person. And the second one, there is the information regarding the situation from the 1 year the Princess Diamond, yeah. As we remember that the contagion from the elderly and the environment, you can imagine there is the big I mean the luxury the luxury ships, and there are many peoples inside the and most of the cases, I mean the positive cases from COVID-19 are elderly also. And the conclusion for a while, especially from that case, the environment, they explain regarding the air conditioning is not good for the situation because it will be spread rapidly, the COVID-19. As we know that the COVID-19 is the one of the disease can be spread by airborne. And now we will move on to another country, still ASEAN country, South Korea. My experience before Daegu is the one city in South Korea have been reported the first super spread number of COVID-19 in February. I remember in January, I visited the country, and especially also in Daegu. But after the February, the one information regarding the super spread of the COVID-19, the city is like dead city. It's very, very sad to see after the situation. But I want to describe the overall situation in South Korea as the same Asian country. We appreciate that South Korea can be handled faster as possible because the country of the South Korea have a good basic in financial and technology power. All of the community can be get laboratorium diagnostic, and most of them also can have facilities, especially for quarantine and also for admitted in the hospital. That's the South Korea handled of the COVID-19. What about Vietnam? Vietnam is our neighboring country also, especially the same South Asia's country. Even Vietnam have a different strategy with Korea, but we can see the result, especially the number of morbidity and mortality in Vietnam are very lower. I didn't know the what situation right now, but in March and April, as I know, no number of the death or the morbidity. There is morbidity, but there is no mortality on COVID-19 in Vietnam. But we know they have a different policy. A socialist country, the strategy is by military and strategy with a lockdown. And no more community or no more people, no more individual can cannot going abroad, cannot going around city, and they can handle very good and manage the situation very good. So that's why the number of mortality is still zero in April on May 2020. And the last is Indonesia. As Indonesian, we still remember the first information regarding COVID-19 on March, yeah, early March. But most of perception in the community, they still thinking, that's in China. It's far away from Indonesia. So we can relax, we can think that we cannot get the COVID because there is different countries and etc. But the situation like a global situation, global transportation, everything is happen faster, yeah, than they predict in the early of March, and that's in middle of March. There is information regarding the classification of the patient, like we call it ODP. Or ODP is orang. Sorry, I inform in Indonesia. The OTG is orang tanpa gejala without sign and symptoms, and the PDP is a patient that's already confirmed that they get COVID-19. And after that, there is 1 and 2 patients in one city of Indonesia, in Bogor especially. Many informations spread faster, especially from the media. So there is, I mentioned on the discussion, the problem of stigmatizations is about not only effect to the social but also economical problem, social problem, even politic, and maybe no, not maybe the social shape. As we know, most of people in the community just aware, there is a dangerous virus. There is the virus that would be led to the death. So we should be careful. We should be aware. We should be protected not to get this virus. But as I analyze in the first step, the problem of politics and policymakers is not enough to give the information or communication through media, because most of media, especially from abroad, already spread in the community. And actually, we need the cross-sectorally commitment. Even there is health workers or non-health workers, that virology, epidemiology, pharmacy, social, law, international cooperation, to handle or to manage the information, and especially also the situation COVID, not to spread more and more in Indonesia. But as we know also, the number of COVID-19 patients increased rapidly in Indonesia. Even there is also balance with the number who recovered from the COVID-19, but the number of mortality is also high. Therefore, my title of the review is regarding political interest. And I saw the political interest and also media is a catalyst for stigma. The stigma of COVID-19 in Indonesia start by starting frontline, especially staff of healthcare, and like nurse, medical doctor, and who works in the hospital get the high stigma until now. Yeah, at least in Indonesia, people, especially in frontline, they share regarding their role in frontline. But in the other side, the lay community thinking about the different perspective, because nurses, medical doctors said we are the front line to handle or to protect COVID-19. In the other side, the lay of community thought about they didn't rule to protect or to prevent from COVID-19. They think, there is already doctor, there is already a nurse, there is already health workers. So we didn't aware about how to protect themselves. For instance, like utilize the protocol, health protocol, especially in the public, in the mall, and also in the public transportations. That's why I'm thinking the stigma is in quotes, yeah. It's like created by society. It's we don't know where is the society, but right now the information are very various among area in Indonesia. The one is very aware to observe the health protocols, but in another side, they didn't care about the situation. COVID is COVID, but I have a different life that still exists in Indonesia. In conclusions, I'm trying to inform stigma can happen naturally due to deliberations. And many parties play the role in the creation of stigma. Still in quote, creation, we didn't aware that we create the stigma itself, especially health professional, us frontline and the lay community in the back line. Generally, a large number of people have no exact answer to the situation, and it slows down the decision-making process. Moreover, a stigma among society is still happened. The effort of changing this stigma might take a long time. And whether this pandemic is going to be over or not, the stigma has been rooted deeply in the group of people. That's would be all of my presentation. Okay, thank you.